After, what's your name again? Sarah. After Sarah, we'll try and go through more protocols, so we have a larger vocabulary. Kidney 7 usually does a good job for plantar fasciitis, and stomach 41 needle it towards kidney 6. So that would be my dogma for plantar fasciitis. However, now someone's coming running, someone's going running and gets plantar fasciitis. You have to think, what's the usage of the body? What's going on here? Okay, so is it possible that it's not the fascia is inflamed, but when they're using the foot, the body in a certain way? Now, you didn't tell me what else the patient has or what else, it could, for example, somebody could have, like you call heavy-footed type person, not necessarily because they have a lot of weight. I mean, that could be another story, but because because they just bang themselves into the ground, when they run, and they'll show it to you when they walk. So there needs to be a little bit of a lift in them, in order to avoid this crunching. That could be it. It could be, okay, you've heard gallbladder 34. You call what?
Releases
Oh,
the sinews,
yeah,
but I don't think
yeah.
that's what you mean. Releases the sinews, is that what
It's the, yes, it's the meeting point of the sinews. Sorry, I should have been a little bit more specific. Yeah, you call gallbladder, and I call gallbladder. Fine, no problem. So, but why is gallbladder 34 master of sinews? It makes no sense. First of all, I can tell you that practically speaking, liver 8 is the if you want to release sinews, the first one you should look at is liver 8 and not gallbladder 34. Just right off the bat. My own clinical experience. Guaranteed. Plus, how did you get to gallbladder 34? I understand liver and sinews, I get the dogma. But that's like going around the block. Literally, from this side to the outside. I understand it's a yin-yang pair, but where did they choose gallbladder 34 from? How did that come about? So, when you are, and this can happen in running, so that's why it's important. So any kind of movement, or any kind of torque that you do, okay, twist and shout sort of thing. Any torque, if you stand up, go ahead and pretend you're in 1964. So it's going to come from gallbladder 34. For us, it's a great point for sacral. People come and say, I have sacroiliac pain, we use gallbladder 34. Gallbladder 34 is going to get involved because of the location with anything that torques. When you're torquing, who's involved? The tendons. Not the muscles. The muscles don't torque because the torque is over a joint. So it's the tendons that are getting torqued. That's why, because that's the base of most of the body's torquing. That's by gallbladder 34, in my understanding, is the master of the tendons. So now we call it master tendon. But it's because it's master of torque. Because if you're looking for tendon, like regular tendon, I would say liver 8, not gallbladder 34. Even though gallbladder 34 does a good job, for example, for hands. It's not like it doesn't have,
What's the theory behind liver 8 then?
It's on the liver channel. It's the water point of the liver channel, meaning it brings yin to the liver, by the way, let me do this just at first. Kind of like, why do you care? It works. No, and you have to accept some of these things because the rest of, I can now give you a theory, but then it's all based on some assumptions that we all decided to agree with. Now, we decided to agree that liver and tendons are related because what? Because some ancient book says so? What happens if it was a misprint? And now for 2,000 years we say the same stupid thing, and we're repeating the same mistake that some printer took the wrong block and put it in the book. It's like, it's not like today. And then the guy that writes the book says, "You idiot! I spent 5,000 yen on this book, and now it's all fucked up, and I can't redo it because it's not like today you can just reprint." How do we know? So it's like we can't don't believe everything you read in the book. But assuming that the liver wood channel is the channel that's responsible for tendons, you know, because that's what it says. We don't know where that came from exactly. I mean, we relate it to blood and you know, blah, 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 blah. The liver, the character for what the liver is responsible for is something that's like bamboo, striated, well, I think striated like bamboo, but it's bamboo, which also, by the way, has strength. Not only is it striated, but it has strength. That it's a bamboo with strength. That's literally the character for what something in the body that's like bamboo and has strength. Okay, like a knife with a handle. So what is that in the body? I disagree.
Oh, okay.
Actually, interestingly enough, you see, that's the thing, that when you start looking at the character, tendon is, yeah, it's striated, but tendons don't necessarily have, who has the strength? It's the muscle that has the strength, not the tendon. The tendon is not supposed to have strength. The muscle is the thing that does the work. So inside, now, the problem is, now you're getting into this problem that spleen is responsible for muscles, according to TCM, and that's not totally true. The liver is responsible for the power that the muscle has. Okay? You have to have liver blood in order for the muscle to have strength. The spleen, the character for the spleen is something between the muscle and the muscle and the skin, which is fascia. The spleen is not, so yeah, so many people don't say muscle, they say flesh. It's the mass of the thing is the spleen, okay? But not the actual muscle. Okay? The muscle, or you can say the body of the muscle is the spleen, the bulk of it. But the strength of it is related specifically to the liver. Okay? But we generally say liver and tendons rather than liver and muscles because then it will create a controversy. You know, well, I thought spleen was muscle. You know, nobody wants to stand here in front of people and say, okay, well, you know, you've got this contradiction. So we just leave the books as they are. Okay? So liberate, if you're looking for, so if we're buying into all the dogmas, it's the water point, meaning it's the nourishing point, even though it's a wood element, and water is actually the daughter of wood. So it's not in 5 element terms, but in terms of bringing in yin, you know, it's the moistening point, let's say, for the wood, for the liver channel, for the tendon channel. Therefore, that would be my explanation of it. But honestly, my explanation is, it fucking works. You know, no, so then you make up your own stuff. No, and it's important to make up your own stuff. Why? Because if you make this, what you need to do is make up the stuff, but don't be married to it. Okay? So you make up this stuff and you watch, how did I make up this stuff? And then you go, that was cute. And then you go, what else can I make up? And then you go, can I test it? Now, we're not starting from scratch. We are talking about 2,000 years worth of medicine. And even if there are some printing mistakes on it, there's still, we assume the bulk of it has something relevant to say. So we investigate and we take what the ancients say and we take that, but it doesn't mean we can't change things and say maybe it was true for this author, but it isn't true for me. You also have to look at who are these authors. You know, with a Ling Shu Wen, we don't know. All we know is that this is what survived. But for example, you know, 34 years ago, they dug up these caves, the Ma Long Tui, and they found all sorts of texts that totally contradict things in the Wen. You know, how do we know how many Shanhan Lun existed 2,000 years ago? There's Shanhan Lun by Zhang Zhongji. Okay, fabulous. And we all like go, Zhang Zhongji, best herbalist ever alive, you know. And yeah, and he happens to correspond because he has the 6th channel, you know, level thing. Therefore, because this phrasing exists in the Suen also, so we say, oh, it must be true, blah, 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 blah. How do we know that there were not 50 others more brilliant than him? I'm not saying there were, and I'm not saying he's not brilliant, but I'm just saying we just don't know what's really survived. And of the things later that are in writing, these are mostly the imperial physicians. They're the ones who write, because they're the imperial physicians. Well, what do you think they're dealing with mostly? With the emperor's spermatoria. You know, that's their main. I mean, the emperor is not sick all the time. I mean, yes, he has a huge harem, and there's lots of people living there, and these people are responsible for them. But they're not dealing with the same kind of diseases that everyday person, that the Bell doctor is dealing with on a regular basis. So their books are very particular, and they are able to impose a dogma. And then in 1905, you have the 5 schools getting together and imposing the dogma that now we call TCM. It did not start with Mao Zedong, just so that it's clear what we call TCM. That ideology was starting at the beginning of the 20th century. It's not Mao's fault. Not that I like Mao, but just let's not over...
Leave him out of TCM.
Leave him out of TCM. No, I mean, the Cultural Revolution accentuated the trend, no question about it, but it's a trend that was already there. You know? So the thing is, it's all agreements that people have about what's what. So what I'm saying, look at the agreements, question them, see if it resonates for you, make the medicine your own. Once you do that, and you do it based on what you know, what the dogmas are, then you release yourself from the dogmas and start developing your own dogmas and test them out. They don't work, throw them out the window. They do work, keep them, make them out. So like I'm saying to you, when somebody has orange U around here or red U around here, I believe that there's not immune disease involved. You know, by the way, on her, how come her arm gets better when I do mushu? Okay, I believe because genetically there's not an immune thing going on. By the way, she shows UB43, which for me is the genetic disorder point. Somebody has a genetic disorder, something, I inherited this from mama. She didn't say I have lupus, but she may still get it, by the way. But if she does, UB43 is the point that we use to treat genetic things. She showed on the right side. Now you can say because it relates to liver, Ga1, fat. You know, the missing fat shoe is UB43. That's the literal translation of it. Okay, so fat relates to liver. We know she had liver on the front. So it may be purely liver, I don't know. It could be that. But it might be an indication of genetic. And she has this. Now, and I'm thinking, if mushu, normally for rapid pulse, not how she has slow pulse. Rapid or normal pulse, REN4 is my main point for autoimmune disorders. Okay? Because she had slow pulse, I wasn't going to check if REN4 was going to work for her. Because I don't needle abdomen for slow pulse. Okay? Because needling abdomen, people with a rapid pulse, if you tell them breathe in the abdomen, they calm down. People with a slow pulse, that's not the method to calm them down, is abdominal breathing. That's not the best thing for them. Because what happens is you can slow the pulse further, and that's, slow the pulse, not the breath. You slow the pulse further, that's not a good thing. You don't want people to breathe, if they're already, slow the pulse. If the pulse is slow, let's say they have 60 beats, 50 beats a minute, and you make them go down to 40, that's not a good thing. It's not necessarily healthy. So Nagano differentiated, which I don't agree with, but you should know this. Nagano differentiated autonomic nervous system diseases. He always wanted to know rapid pulse or slow pulse, because rapid pulse he considered to be sympathetic dominance. Rapid pulse, sympathetic dominance. Slow pulse is parasympathetic dominance. Okay? Which is very weird because we don't think of parasympathetic dominance as a problem. Yeah. By the way, that's why it's so important to release the neck. I always look for neck for the SCM. Why? Because that's the vagus nerve. Vagus nerve is the most important parasympathetic, one of the most important parasympathetic nerves you have. If you want to give people space and light, you have to get them into parasympathetic mode. Healing doesn't happen in some dinosaur. That's not a healing modality. Over there. So you have to get the person into a parasympathetic mode. If their vagus nerve is congested, vagus nerve is a parasympathetic nerve. If the SCM is congesting over the vagus nerve, it means there's no parasympathetic signaling going to the body. It's a cranial nerve that goes down to the body. So you need that. So you need to release the SCM. That's one of the fire points, and releasing the SCM is the most important thing you can take out of this class, I swear to God. The rest is like fluff, extra. It's nice. It's good if you have it. So mushu for me is the replacement of REN4. It's an equivalent of REN4. Okay? Now, this autoimmune disorder treatment, REN4, why? Because, yeah, I told you, if there's a fire point is painful, we do metal water. Autoimmune means systemic metal, it's systemic inflammation. Oh, you will do. Systemic inflammation, so we use systemic metal water. What does it mean? Systemic water is what? It's kidney channel. So I'll use something on the kidney channel and something on the lung channel, that's the metal. Okay, so that's just like a fire point on a specific channel, except they're autoimmune, so I'm doing that. And I'm using the mu or the shu point, depending. If slow pulse, I use the shu point of small intestine, which is the fire of fire. Okay, so Ren 4 is the mu point of small intestine. And since on Hara, I can't guarantee she has autoimmune, but I'm saying one of the reasons why mu shu works, because it's between the mu and the shu of exactly the small intestine as it happens. I use lots of mu shu as a substitute for Ren 4, especially with slow pulse. So I think that's why suddenly it affects the body. But what was interesting about the first case is what we saw is we weren't even addressing so directly her symptoms, polycystic ovary. We were really looking at what's underneath, and going, wow, when you're addressing something that's constitutional for this person, the shoulder changes. Because by the time we got to the back, we weren't doing that much work, for the polycystic. And still, she says, wow, my arms are better. You don't have to work with the arms directly. You have to take away the layer that's obstructing. Okay. So with plantar fasciitis, we start with gallbladder 34, if you believe the liver, blah, 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 blah. It may be because when they're running, I didn't go with them running. And I'm not the expert to tell you what the right form is. Some people run and they kick with the heel they kick the butt. Some people lift forward. Some people, I don't know what this person's doing. Maybe there's a torque that's creating the pain. So maybe gallbladder 34, and maybe you can leave a press tack on gallbladder 34. It's the same idea with stomach 41. Stomach 41 is like the hinge for the foot. So you're hopefully releasing the alignment of the foot that way. Any other questions? Sign language. Would you like to come in?
Yeah.
So, that's you.
Yeah, that's me.
Anxiety and IBS, but interestingly, you're saying anxiety, but the MD is saying depression.
Yeah.
So tell me what's going on.
I don't know, I read up about depression and I didn't feel like I had everything that was, what it was saying was depression, and I know that my dad has anxiety and my sister
Tell me
has anxiety.
what you know. Forget the words. Forget the label.
What
do you feel?
The feeling?
Yeah.
It's like, it's more like in my stomach, like kind of like 1,000 butterflies sometimes. And then like I used to get really bad panic attacks. So
In the chest? Or
yeah, in the chest.
Hard to breathe.
Yeah.
Okay.
Yeah.
And you had eczema as a child, and you had asthma apparently.
Yeah.
First major attack, and then we don't see it again, but I'm assuming it came back.
Yeah.
Okay. The reason why they diagnosed you with depression, not knowing, not being your psychiatrist, and you not saying I feel this, and it's like blah, blah, I suggest that because of your fatigue, they're saying depression.
Yeah.
The word depression. Anxiety means jittery, worry,
Yeah.
this. Depression means I have no strength. So in TCM, they'll say depression is usually they say dampness. Okay, because one of the things. Okay, so here's the question: when you feel depressed or anxious, because we have these words, it's not just clear to me which one to use themselves, but do you feel very hard, depression is the kind of where you say to someone, just go out, go out and breathe some fresh air, and they go,
Yeah.
I can't. That's depression.
Mm.
Okay, because it's for TCM, I don't trust them. We say, so I'm addressing you to them rather than to you. We say depression is like being in a swamp, when, it's dampness. When you're in a swamp and, it's like when someone's sinking in a swamp, you tell them, lift your arm and pull, and they go, we can't. They really can't, because the dampness pulls you down, you can't do it. You just do, like, even though you know you have to, and you can't do it. That's more depression. That's why with fatigue, it's very standard. That, the psychiatric world will give you the depression label. That's, I think. I don't know. And you're not taking anything for the depression. Although Emmett, no. Okay.
No.
Okay. We discovered that mononucleosis is glandular fusion, right? Okay, good. Because we don't use that term in the States.
Oh, okay.
So I want to know what it is. Panic attacks, okay. And when was your last asthma attack?
I think I've had, oh God, it must have been probably when I was about 11, other than the first one that I had, which was the biggest one.
So at age 5 you had one, then at age 11 you had one, then
Yeah.
since?
Not really, just
Do you
like,
carry an inhaler?
yeah, but I
Okay.
try not to take it anymore.
No, I understand, but are there times when you have like some shortness of breath or
Yeah.
some, okay. When you have an attack,
Mhm.
by the way, this is one of the weirdest questions out there, because officially there's no such thing as breathing out or breathing in asthma. Asthma is defined as the alveoli in the lungs have they're like this and they expand. And there's a phrase in chemistry for that you take something and you expand it, it reaches its maximum circumference and maximum stretch. And when it does that in asthma, it gets locked and it won't come down, which means they can't breathe out. So therefore the question is that on breathing in and breathing out, it's subjective, it's not the reality of what's happening. What's happening is they can't breathe out. The moment you force the lungs to collapse and push the circumferences back in, they no longer, the asthma is gone. So what happens is they're just stuck in either totally like this, a very small amount of flexibility. Okay, so that question, really officially asthma should not have breathing in as a problem, but the patient still feels like they can't breathe in. You can still feel the wheezing either on the in-breath or out breath. So we still ask that. Okay. So when you have a semi-asthma attack now, because it's not full, does it feel like, or does it, out breathing or in breathing? It's difficult for you.
I think it's both.
Okay.
I'm trying to think about, it's really hard.
Because with panic attacks, it's in,
Yeah.
right?
Yeah, I guess it is out.
With the asthma.
Yeah.
No, it can be in also, because the feeling, because what happens is your lungs are full, you're trying to take more, it's almost like you're trying to outdo it. So it feels like the in-breath is stuck, but it's actually, it's an inability to breathe out. That's why many asthmatics, if you invert them, you're pushing the diaphragm up, you're forcing the alveoli to sort of shrink back. So, all right. And the IBS again is a slightly unclear diagnosis, because, so tell me what you have.
It's like
Syndrome.
it's like a cramping feeling every time I eat. I got it really bad in third year of uni, yeah. But then sometimes constipation as well.
So she has officially true, because it's, in fact, irritable bowel syndrome, there's no clarity, and different doctors will different locations geographically will call it something else. The standard that I'm familiar with is cramps with constipation and alternating diarrhea, which is exactly what she's saying. Okay, but there will be people who will not diagnose it that way. So that's pretty much what you know.
Yeah.
Okay, cool. Can we take your socks and shoes off?
Yep.
Sarah, do you mind if I'm videoing?
Yeah, that's fine.
Sure?
Oh, that's fine, send it to my mother. Now, one of the things she describes very clearly, okay, so she has something from birth, because she has this eczema from birth, which means that she probably had the asthma from, she was susceptible for asthma from birth. She just, her first attack was age 9. And the thing that she's describing very, very clearly is butterflies in the stomach. That's a very particular situation. My belief is that she has a weakness in that everything comes from weakness in the stomach, from what she's describing. And it's a weakness in the stomach more than anything else. So let's test that theory out, see if it's correct or not, because that's just me saying it. But, so face up, that's on the head.
Yeah.
We had acupuncture before.
No, it's okay.
Totally.
This is a gentle start. Honestly.
Yeah. People who have, you'll see this in the elderly also. The stomach is a sac, and it's a sac that's supposed to expand and contract back. That kind of, so if you, women don't have another place where you can see that kind of tissue. Men do. Your scrotum is the same tissue as your stomach lining. I know it's a little strange. But you can test out your stomach by looking at someone's testicle. It's wrinkly skin. No, it's wrinkly skin that sort of overlays. So it's called rugae. Your bladder is made of the same tissue. Your uterus and cervix are made of the same. It's that tissue of like overlaying, wrinkly overlaying, that's called rugae. So those are the places in the body you have it. So externally, if you want to have an idea, the scrotum skin is that. Okay. So when the rugae is weak, when it loses its elasticity, the stomach shrinks. It can't expand. So think about it as the difference between a back bend and a forward bend. Okay. So as the stomach gets weak, what will happen? The distance between REN 15 and REN 8 shortens, and you get this kyphosis. So sometimes, now, the nerve that innervates the stomach is a T5. Remember, it's one of those crucial kyphosis points, T5. So the kyphosis and the stomach are highly correlated. So when people have stomach problems, my belief is that she has a stomach problem. That's why she's also fatigued. It's not just that, I had mononucleosis. You kissed the wrong person, you got mononucleosis, now you're fatigued. I don't think so. It's kind of like, I know people, my belief is originally stomach is weak. And that's possibly the origin, but it's just a point in my head right now until I test it. But look at her toes, especially those. These last two.
It only gets weirder.
Didn't you do a pedicure yesterday? Beautiful. Okay. Can you peel a banana with your toes? Right.
Do you mind trying?
Yeah.
She can't. I guarantee she can't. So narrow. It's depression style person. The bafang are going to be tight. Okay. So there's not enough oxygen in the brain. Where is the biggest part? The brain has the biggest mapping of the brain comes from this area, and the equivalent area in the feet. So for Nagano, treatment of depression and headaches is the bafang. Okay. All 8, or if you want to save needles, the gallbladder and liver ones are the major ones. Okay. The gallbladder liver one on this side is extremely narrow.
What is it? The gap?
Although,
Is he
can
talking
we move
about?
that little one like a sunchild?
So that's
but not sideways.
Okay, I see.
Yeah. But, now people where it's a lot worse, it's a lot tighter, but she has that tendency towards tightness. Is this going to come up? Or what's the story here? These are the shorts.
The least fitting.
We won't be doing it again. It's okay, except through the pants. It's okay. All right. Lie down. It's okay. No problem. All right. So, And this is the eczema?
Yeah.
Okay, and here I see a little bit.
Yeah.
Where else do you have it?
I did have it on my legs. It's not so bad, like, it's just probably now dry skin. It's just dry, like.
But this, because you wash your hands and stuff, it gets kind of irritated
Yeah.
and splits and bleeds.
Yeah.
Do you use medicated soap, like the antibacterial stuff?
What, like hand gel?
Yeah, but you can get it in the hand washes.
Oh no.
I was just going to say, because I have ladies that happens to, and it's because they're using that, and it just aggravates the skin.
Yeah.
It's all split and sore, so they stop using it and it goes.
Oh.
But it's the antibacterial ones that you buy that seem to be too strong for some people.
Yeah.
If you work in catering or something and you have to use it all the time, it seems to happen.
Yeah. Yeah, that was really bad actually. I used to work in the kitchen, and yeah, the stuff they had was really, really bad. Like cracks.
Yeah.
All right. So. No, it's okay. All right. So we start left stomach 27. So we start with spleen 9. Hi, when I press here, you just, now she has IBS, so I don't know if that will be normal or not, so I can't say this will be your baseline, but I'll just, when I press here, do you feel anything uncomfortable?
No.
Okay, so this is comfortable, no big deal?
Yeah.
Okay, so we call this, so this is what my fingers feel like, okay? If anything feels different, you let me know, okay?
Okay.
Doesn't have to be painful, just different than baseline, okay? Hi.
Yeah.
Yeah, okay, and she's gonna have red 9 pulse because I can feel it already here, okay? Hi, how about here?
Yeah.
Yes, worse, okay. So immune, because we know she has an immune problem, and she has a lung problem. It's expected I will find right stomach 27 from her, you know. Okay, how about here?
Yeah.
Yes, oh, sorry. And here,
A little bit.
a little bit, so possibly adrenal, but very clearly Oketsu. Oketsu's solution is liver 4, but our liver 4, a few things about liver 4. I've seen people take liver 4 in the weirdest locations, okay? It's on this side of the tendon, not this side of the tendon. This side is stomach 41. It's got to be on the medial side of all the tendons, okay? Because I know people take it differently. Now, a textbook location is here by the bone. I take it a thumb down from the bone. And it's important. It makes a huge difference. I also want to explain to you that liver 4, I know everybody knows liver 3, right? But liver 4 is the only point, chapter 2 of the Link Shu, we talked before, it mentions all the antique points. It says this is this point, this point, this point, this channel. When it reaches liver 4, it says this point, if you needle it with the flow, it creates harmony in the abdomen. And if you needle against the flow, it creates havoc, chaos in the abdomen. Doesn't say anything like that, doesn't give any indication of any other point. This point, so something about liver 4 is very important for the author of the Link Shu. Okay, and most TCM people don't even know that it exists. It's like it's a point that doesn't exist. There's liver 2 to take out fire and liver 3 for harmonizing the liver, something like that. This to me is a much more useful point. Okay, so she had Oketsu, lung, adrenal. How about here?
Feels a bit weird.
Do you see my finger moving?
Yeah.
Clearly there's a pulse here. Okay? This is a very common finding. Okay? Not just for people. In her case, she comes and says anxiety or depression, depending on how you decide to diagnose. So expected, but I would say half the people in the world, or in America at least, seem to have it. Okay? It's a very, very common finding. Now, how's this? Why are you smirking?
It's just really weird.
A weird feeling.
Yeah.
Empty?
Yeah, kind of.
Jittery?
Yeah, a bit jittery.
Okay. No, I was expecting pain, but when she's smirking, I don't know what's going on. So, but then there is something. No, it's okay. It's whatever. So something in REN 12, because my original belief is REN 12 is the cause. That it's REN 12 that's the origin. How about 15?
That feels like you said, like empty.
Empty also. Empty and empty. Okay, hold on one second. When this doesn't feel empty, right?
No.
Okay. So I just want to make sure, because you don't know what people mean. Now compare for me left side and right side. They're the same and they're the same. It's totally
Yeah.
fine.
Yeah.
Okay. How about here?
Feels heavier.
Heavy.
Yeah.
Okay. Pressure?
Yeah.
Okay, you don't like this.
No.
Okay, fine. Just asking. Okay. Did you say cardiac disease, anybody?
Yeah, my dad has like a irregular, like heart rhythm.
Okay. The reason I'm asking is because I can feel her pulse on REN 12, and not huge amount, but and I can also feel it slightly on REN 15. So I'm kind of like, is there a cardiac disease in the family? What's the options? And the pulse, I believe, was slow. That I call slow. Would you agree?
On the slow side.
Hmm?
I'd probably say it was on the slow side. Well, that would be my
I think-
interpretation.
I think it's slow. So I don't do the watch thing, so I can't. All right. Then we have to check the neck. Okay. So relax, you don't have to do anything.
Okay.
Okay. 1, 2, 3.
Can you do that
discomfort?
again?
Yeah.
Sorry.
1, 2, 3.
Yeah, middle.
Middle. 1, 2, 3.
No.
Nothing. Okay. Right now, I'm on the right side. I'm going from under and pulling towards me on the cervicals. On the right side. 1, 2, 3. 2 and 3, right?
Yeah.
On the left side, I'm pushing towards the 1, 2, 3.
Yeah, 2 and 3.
2 and 3. Okay, makes sense. Phrenic nerve, C3. She has an asthma. The diaphragm is going to be pushing. Again, it's not going to be happy. It's going to show on the phrenic nerve. Now, 1, 2, 3. Anything?
1.
1. And kidney 27. 1, 2, 3.
There's 1.
Kidney 27 both sides. So bronchial reflex, as a result of her asthma. The good thing is there isn't lower down, because the lower it is, the more, the harder it is to treat. So strangely enough, even though she's had asthma from a very early age, she's not showing huge amount right now. Like it's relatively easy right now. Now, my lung 10, my fire point is not here, is here. Okay, so that's one of the things when you're checking fire points. Any discomfort?
Little.
A little. How about here?
None.
Okay. Pericardium 8. Pericardium 8. Anything?
Feels different on that side.
What's your blood pressure, by the way?
I have no idea. I don't know.
Okay. I'm going to suspect that she has low blood pressure, but I don't know, so I don't have confirmation. But there's a difference between, this one is,
Yeah.
what would you call this? Feeling when I'm pressing. What would you call it?
It's just pressure. There's more pressure on that
There's
side.
more pressure.
than this.
Do you like the pressure?
It's okay. It's not discomfort.
Which one do you like more? This one or this one?
This one.
This one, okay. All right. So some people, it's hard for them to say what's going on. Okay. So I'm believing that I'm still willing to take REN 12 as my major thing, but I have other things to resolve. So I have the oketsu, the lung. That's why I checked lung 10 immediately, because I want to know. Now, can you take a deep breath? Sorry, take a deep breath for me. And out. And again. And out. Yeah. On the out, I'm going to take my, listen to it.
A little stuff there.
There's a little, yeah. You don't hear that on the in-breath. So she's definitely out-breath. The reason why it's important for us, asthma when you hear the is kidney 3, or actually you can call it kidney 4, okay? asthma, for the out-breath, there's an expression that the out-breath comes from the chong. We use spleen 4. Okay? Now, I have to make sure spleen 4 I don't use if she has a very weak, small pulse, and she doesn't. Okay. Chong is to surge. Okay, you can't use it unless there's something surging in the body. Okay, so I can't use spleen 4 unless. Okay, so my question is going to be, I want to see if spleen 4, which is the point I'm getting from the asthma, is going to do Ren 12 or not. So remember you have here, right?
Mm-hmm.
Feeling jittery, funny, right? And then you have here unpleasant. Okay. Actually, let me give you a review. Stomach, I'm just naming them. Sadness, anxiety, stagnant blood, lung, adrenal left, adrenal right. Can you remember what they feel like? Vaguely?
Yeah.
If I ask you if it's better or not, I know. I'm going to ask you, is it better or not, basically.
Yeah.
Do you want another review?
Yeah, go on.
Thank goodness you said that, because I needed it to.
Yeah.
For you, it's Ren 12, for her, it's stomach. Ren 9, for her, it's sadness. Oketsu, left stomach 27. Right stomach 27 is lung. That's the worst one, right?
Yeah.
Okay. Adrenal on the left, adrenal on the right. Okay? And anxiety. Okay? So now we have the review. Okay. Now, I want to see what's major. So, spleen 4. How is stomach now?
I don't feel any.
Interesting. Okay, fine. How is sadness?
Still there, but it's
But
not
much
as-
less? Or-
Yeah.
Okay, fabulous. How is oketsu?
Can't feel it.
Okay. How is adrenal on the left?
Can't feel it.
Great. I don't know if it crosses. Spleen sometimes does cross. But, that's why I have the answer now. How is lung reflex? She's laughing. Well, I think we got a clear picture. Okay, wonderful. How is anxiety?
There's nothing there.
Okay, so spleen 4 is very important for her. Okay, now, by the way, you were born with eczema. I think you said something about Mama had eczema?
Yeah, my mum has sometimes eczema.
And, hold on, and Papa had depression.
Yeah.
Right? Okay, so she has things that are inherited. What's the name point?
Gunson,
What does that mean?
grandfather, yeah.
Right, grandfather, grandson, but parents must be in the middle. Can't have grandfather without having a parent, we don't get born to grandparents only. So, something to do, again, maybe to do with genetics, okay? My main thing is to clear stomach 12. Okay, so I figured spleen 4, I know I'll go back to it. But just because it cleared everything, I still want to do other things. So, I think I want to show you. So, triple warmer 16 is behind the SCM, is the gland area. She had glandular fever. Okay, originally Nagano called tonsillitis point. Okay, remember Nagano lived when everybody's tonsils were removed in the 50s. They just take them out. So, but it's an immune gland. It's important. It's your first defense mechanism. Go through the tonsils. So if they have back here 1, 2, 3, anything 3 especially. Okay, so let me show them on this side. 1, 2, 3. Not so bad.
Yeah.
This one.
Yeah.
Okay. So that's triple warmer 16. We call immune reflex. Okay, which can also show right stomach 27. Can also show, some people come and they say, I have a back pain, and they say like this, across the PSIS, not the piriformis, above. It's above the crest and above, it hurts. They say it feels tight, heavy. Okay, that's an immune style back pain. Okay, the other kind of immune back pain is when they say arching, doing this, tucking under and arching, that hurts the back. That's immune point type indication. The other thing is because we say, I know you say it's a liver headache, we don't. This area here, temporal headache, we say it's glandular headache. Okay? So if somebody has that kind of headache, we may do 3 points on the immune point. Okay? So, you said this one you don't like, right? Okay. Now, this is a really useful area. Watch what's happening. I pressed on Sanjao 16. Okay, she says pain. Now I'm leaving my finger there touching the skin because I want to feel what's happening above my finger. Okay, or normally it will be below my finger. So think the expression would be really below, except here it's above physically. So I'm looking for the attachment of the muscle to the bone here, see if there's any glitches. Not that much for her. But I want to see, when I press here and I'm just touching the skin, I want to see if I can feel in my finger, my pericardium finger, if I can feel something dissolving there. That's one of the very few places you can feel that. Okay? That's not the normal thing. Normally you press back again. Here I felt something moved, so now I'm gonna press again. Hi, how's Sanjao 16 back there?
Nothing.
Nothing. Great. Okay. How's Ren 12 stomach?
It's okay.
I understand. The grandfather-grandson point was better at the foot, right? Did a better job?
Yeah.
Okay, fine. But this does something.
Yeah.
No problem. 2 of them. How's now?
Yeah,
Not there?
not there.
Okay, good. All right. How about sadness?
It's not there.
Cool. How about stagnant blood?
Nothing.
Okay. And adrenal on the left?
Something.
Something. Okay.
Yeah.
So, another okay, so, I'm taking my ideas and I'm testing them out. That's the most important thing. How am I getting the ideas? That we haven't done yet because we haven't gone through enough protocols. So I'm teaching you the protocols as we're going along. And by the way, how's 17?
Nothing.
Nothing. Great. So this and spleen 4, I know I'll need lung 5 also because I need for asthma, and I'll check it with relax. You said here, right?
Mm-hmm.
My lung 5 is a little further out than yours, in all likelihood. Hi.
There's nothing there.
Nothing. Great. And by the way, does it help the stomach? Just curious, what else does it do? I have to do it regardless because she has asthma. Not huge help or some help? Or
Yes,
teeny-
some help.
Okay, fine. Just checking. And, well, it's a point that's prescribed for stagnant blood with liver 4, so it's unfair. I'm not going to bother with checking that. How is sadness?
That's definitely a lot less.
Okay, so I'm just checking that I'm not just going after one symptom, but I'm really treating as much as I can. Now, the only thing I haven't checked is because she has, are you okay?
Yeah.
Okay. You have here, right?
Mm-hmm.
Okay. High lung 5.
Nothing.
Nothing. Okay, good. So I have a way to resolve that. That's important for you.
What
Now-
was when you added a second finger on the...
It was still immune point. It was double fuck you. It's a point can be. I told you if she had headache, for example, I can do 3 points in the same time. So since she said some better, but not huge amount better. I mean, I'm just trying to maximize my options.
Okay.
Okay.
And
so
then would
it's
you
not a
needle
different
both
point.
of them?
I would totally needle both of them. Absolutely.
Okay.
Yeah. Now the other thing is, no, don't worry. Skin issues, so now I'm going with some dogmas. Skin issues for me is kidney 9, large intestine 15. Okay, so the next thing I want to do, see, because of her eczema, is how, yes, origin is Ren 12. Ren 12 fixing, especially if they say butterflies in the stomach, is immune point indication. Okay, just one of those dogmas that we have. But, I want to see what else affects Ren 12. For example, spleen 4 did, which was part of the asthma. Now, I'm curious if skin, so touch this area around kidney 9. Again, kind of, you'll see that balloon stretchy feeling. Right?
Same as the last leg.
No.
Yeah, well, its last leg was lower and had more bumps. Different, right? But still something stretchy.
It's not as...
But different, yeah. Everyone's different. Yeah, like in this area. Yeah?
Don't really know.
Did you... Sorry.
Can you lift your pant up? And sit down. No, actually, you're already sitting. Lift your pant up. Oh, somebody said
Is that tender? Is it tender enough?
touch this.
Yeah, that's good.
You've got to be more.
I didn't say take your pen
No,
down.
no,
I said lift it up. Don't press so hard. Go ahead. Okay. Do you feel what you feel with him? Don't classify, don't analyze, don't do anything.
Yeah.
Now, come back here and feel this. It's actually softer now because people have pressed so much. But there's a place where there's a little...
Yeah, there is, yeah.
Okay.
Yeah.
So something, it's not anywhere near as extreme as, the other.
So did you say
Which wasn't that extreme, but...
liver 14, was that?
I think she said nothing.
Yeah.
Yeah, if I recall.
Okay.
And I don't have great I understand skin and liver. Yeah, I
Yeah, no,
understand
I was
what
just
you
trying, I'm
mean.
trying to, yeah.
Yeah, I
It's so
do.
interesting, you think, I just can't, my head's like, wow.
Doesn't relate to the TCM ideologies. It just really doesn't. I mean, some of it will, but liver and toxicity does relate, but
And also
skin
the-
relates more. In her case, child eczema relates more to the stomach. The swallowing the milk, I mean, they can't digest it. It's an allergy.
Not the spleen then.
Oh, yeah. Yeah.
Could be this, you can say spleen if you want.
Okay.
I'm using spleen for, I'm going to use spleen
Yeah.
for in her case. But
Okay.
the kind of eczema that first of all,
It's not a perfect video.
look at the eczema.
Yeah.
I mean, because
Yeah.
it's dry skin that's splitting, it's not toxicity. You would call this yin deficiency, wouldn't you? Wouldn't you say something? I mean, I don't exactly know what they'll say because I don't practice it, but you can't say toxic heat in the blood
No.
for this. Toxic heat in the blood, there's pus. The Chinese love pus, boils, blah, 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 all the disgusting stuff they're into. It's kind of like, this is not, when this is splitting, this is like clearly a deficient.
Dry body fluid. Deficient body.
Your tongue. This is a blood deficient tongue. It's basically orange. Don't you think this is a blood deficient tongue? Wouldn't you say? I don't know. It's not my field. You can say bullshit. You don't know what you're talking about. Bullshit. Okay.
I just said it. You just don't know what I'm
Very good.
saying. Well, there's definitely stuff
Can you do
going
it in an
on-
American accent?
No. There's definitely stuff going on the lung.
Well, she has heat also. Look, okay, she has heat, but the tongue itself it's a thin. I mean, this is, in my opinion, I would classify it as, you don't have to keep it out so much. He's just going to pull it out.
Get the tongs.
Hold it out.
No, because then it gets redder and redder and redder. So let them keep it in and come back out. I would say it's a deficient tongue. You would call her blood deficient.
Call it deficient.
In a sense. Yeah, and she has heat, granted, but you can have it, so.
Can you say it one more time? Okay.
And by the way, she has she has the yellow phlegm. Yeah, she has a stomach that's not digesting. That's what she's had from childhood, from when she was born. Either she was allergic to mama's milk. Okay, we have it's a grandmother and granddaughter problem with the milk. I mean, we don't know. It's like it could be her, it could be the reaction to the milk, but that's why her stomach isn't strong enough. Therefore, she gets allergies because as a child it creates all this mucus and it has nowhere to go. And now, because there's not enough digestion, she's getting there's no nourishment for the skin. Okay, and of course she's going to get fatigued. So I want to make this Ren 12 stronger. Stomach has to be stronger. That's like elementary Chinese medicine, right? Always treat this. If there is something in the spleen in the stomach, you treat the center always first, right? So the only thing I did want to check. Okay, there's something here, right?
Yeah.
Okay. So, by the way, this is not a big trick. Has nothing to do with the skin. Kidney points will often fix Ren 12 anyway. So Ren 12 you can fix with immune points. You can fix with kidney points. Hi. How's now?
A little bit.
A little. Okay, hold on. Let's try this.
No.
Okay. Higher, maybe. No, hold on. Boom.
Yeah.
Yeah, what?
It feels better.
How much better?
A lot better.
Okay. I'm going to start with that. Oh, yeah, I don't need kidney 3, so I'm good.
So out of all the points that you've come up with as being good, what's the reason that you start with this one first? Or is that?
Because it's the one where I have to move the point that, first of all, kidney is deepest. I want it to have the most time, number one. Number two, sorry. Was that okay? It was not the best insertion in the world. Number two, because I had to move around 3 times. Are you okay?
Yeah.
No, tell me honestly. By the way,
Trusting as a professional.
can you laugh?
At first ever needle and you didn't do your best
Look at her
insertion,
gums.
Avi.
Is she blood deficient?
Yeah.
Thank you.
Orange hand.
Therefore, not liver toxicity eczema.
Okay.
It's dryness kind of eczema, as opposed to too much toxicity, therefore treat the liver.
Okay.
That would be liver 5 indication. Okay. Sorry, someone else had a
Yes,
different question.
orange palms, orange feet, adrenal fatigue. Is that also blood sugar?
I don't know.
Right.
I wish I had an answer. I could tell you I have a dogma for it, but I don't.
I mean, strikingly orange.
Hmm?
I've been trying to puzzle what it is, and
Are you talking about her? Or are you
No,
talking
no, I'm
in
talking about
general.
somebody
Okay. Orange hands, orange.
particularly palms, particularly feet. At one point, it spread right up the legs, and as she's progressed with treatment, it has eased on the legs and faded on the palms, but they're still quite bright orange.
Bad circulation, possibly, or they stopped eating carrots after you treated them.
She does eat a lot of. She does eat a lot of vegetables, but I mean, I can't imagine it being. I mean, so you know.
I don't know. I don't have a. I really don't have.
It
a-
was just what you're saying about the gums and that.
Yeah. No, the gums are just because they're. Well, you can call orange, but they're pale. I mean, you know, it's lack of redness because the palms are not supposed to be red necessarily. You know, some.
We all look.
Everybody's different. His is, you know, his is more white ashen. Sorry, but that's. I think you know, just your skin in general is like that. You know, where we don't have red hands and orange is a deficiency of that. But in a place where it would normally be red, that's a paleness.
Thank you.
Whereas on the palm, the orange is actually an excess, if anything. I would say, if any, I'm guessing it could be a toxicity. You know, I don't know what else does this patient have.
She's worn out more than anything. I mean, she came in telling me that she'd got adrenal fatigue.
Okay, well that's cute.
And sometimes she dies very low.
With energy. Okay.
With energy.
What has she done in her life?
Oh, a lot.
Like what?
She's 3 children. She's 33. She's a vet. She's practiced for several years. She was a swimming champion.
Oh.
She's pushed. She's pushed.
Okay, so we agree that I think we can agree that she probably is adrenal fatigued, but no, I'm looking for what are the possibilities of toxicity. She swam in the ocean or swam in a pool? with
I wouldn't rule out ocean, but I think predominantly pools.
Okay, that's one option of toxicity. And the other thing is she's a vet. Do you know what kind of chemicals and crap they're using? These, you know, it's like being an industrial MD. I mean, it's like, you know, because all the bacteria. Okay, how many people here have pets? You know, you go to the vet and he said, rabies vaccine once a year. Bullshit. And you ask the vet, how often do you get it? The vet, no matter how big your dog is, your dog can be Beethoven, okay? You're still bigger than Beethoven, okay? So we're a much bigger body. We do it once every 10 years. Vets have to do it. They don't even do it once every 10 years. What they do is they take titration and make sure they need it. But to your animal, no, they should have it once a year, by the way, because it makes more money. And because the vaccination companies don't want to test it on animals. There's not a big enough market, it's not worth it. So they say once a year. Now they have some vaccines every 3 years. Do you know how much toxicity that is in the body? And the vet is exposed to all this stuff all the time. I mean, it's just being a dentist, you know, that's working with toxicity.
I think the problem started around about the age of 17, 18, beginning of A-levels, that sort of
So
period.
stress, you think?
I think she was pushing herself too hard at that point.
So maybe she's an autonomic nervous system type person. I don't know, because I'm just thinking, you know, I'm trying to relate to the orange and I don't.
Yeah, I'm sorry, I didn't mean it to go this far.
It's okay.
It just seems it followed on, you know,
Yeah.
from.
Yeah. Stomach, how much is left?
Not a lot.
Not a lot, but some?
A little bit.
Okay. How about here?
It's gone.
Gone. Okay. How about here?
It's less.
But some.
Less,
Okay. And then here?
A lot less.
Okay. And it's opposite side. Things are not, we're very used to saying treat same side for same side, except places that cross specifically. Like triple warmer 8 crosses for the SCM. Okay. But if you find the right thing, you're starting to affect the body. What it's telling you is that things are starting to move for this person. So you still have some here
Yeah.
and some here.
Yeah.
Hi, how's this?
A little less.
Hmm?
A little less.
A little less. How much is left from the beginning, percentage-wise?
How much is left?
Left.
About 10%.
10%, great. 10% you can send them home, then therefore they have to come back next week for the extra 10%.
Wow.
I'm kidding. That's Kiiko's flares, not mine. How about here?
Yeah, that's a lot less.
Okay, good. So I chose to start with kidney 9 because if I'm going to use it and I have to play with a point, besides the fact that it's kidney, it's deepest, I want to make sure that I get the, to get the right spot. Now, we know about spleen 4. You okay?
Mm-hmm.
So because it's a sensitive point, I use these. So by the way, who asked me about needle depth or something? It's like almost nothing because you can see the guide tube. Yes, the needle is longer than the guide tube, but they're now almost the same length. How much is the needle longer? Teeny, teeny bit, that's all. You don't need a huge amount. Then, anything left here? No?
No.
How about nothing?
No.
Can't produce anything. Then, okay. So, no, but this one, the phrenic nerve. Here, right?
Yeah.
Okay. Now,
Yeah, it's gone.
gone. Okay. Because I want to confirm lung 5 also. So lung 5, I needle with a direction and totally flat to the skin. Okay. Let's do the other side. Sorry, I'm just going to walk through. Sorry, Fern. Anything here? Yeah. Okay. Hi.
Nothing.
So you're testing lung 5 before the immunity point? Is that correct?
Yeah, because, first of all, yin organ before yang organ for me. Other people tell you the opposite. Acupuncture is going from yang to yin. But for me, I also prefer to start at the feet from the yin. I start, deeper. But the other thing is, once I turn the arm over like this, not so convenient. So you can, and Kiiko often will do this. She'll treat one side of the arm, then flip. So she does 3 treatments, not 2 in one go, in one treatment. I prefer to, to try and get the lung first, and then do the immune points second. How is phrenic nerve on this side?
Yeah.
Yes?
Yeah.
Something, okay. How's phrenic nerve now?
That's the thing.
Nothing, okay. Now, that was phrenic nerve, but let's look at the immunity, Sandra 16, here?
Yeah.
Okay. Boom. How's now?
Nothing.
Nothing, great.
Nothing.
So the needle angle, sorry, are you okay?
Uh-huh.
Is it bothering you that I'm touching the needle?
No.
The angle is towards me. This needle's not wanting to do it. But the angle should be this way. Okay. This is not large intestine channel and it's not triple warmer channel. It's in between. It's how the muscle adheres to the bone. And that's another moxa point, for example. Oh, you asked me about moxa points, and I said that liver 1 is a moxa point because it's wood on wood. Any one, so for example, spleen 3 is a moxa point, earth on earth. Lung 8 is a moxa point, you know.
Element on element.
Yes, metal on metal. All right. Anything left here?
No.
Here?
Yes.
Sorry. Hi.
Nothing.
So right now, I don't need 2 points anymore. It was when it was on its own, it needed 2 points, but I can do 2 points if I want. It's not, you know, okay? And I'll do moxa on it. How's your breathing now?
A lot better.
Okay. How's the butterflies in the tummy?
They're not there.
They're not there. Okay. Is there anything you feel?
My body feels quite heavy.
Your body feels heavy. Okay, that's not a good thing, in my opinion. Hold on. So anything else? No, I mean, you know,
It's all going well
light is
till then.
nicer.
Just, more relaxed.
Oh, when you say
Yeah,
heavy,
heavy.
you meaning it's a
Like,
good thing?
yeah.
Yeah.
Okay, I
Yeah, I was
misinterpreted.
trying to,
Like,
yeah.
Okay, all right. All right. So, no, the reason I'm asking is because she had panic attacks, she doesn't have anymore, is Jue Taiyin and Jue Shaoyin. You know, it's for panic attacks. I'm looking at, do I want to do it? This is the very first acupuncture experience. I'm not so sure I want to, like, start with Jue points. That's kind of scary. You know, on the feet, blah, blah, you know. So, let's look at, so anything that you can complain about right now? Please complain about something.
Wallpaper.
my hands.
What about them? Tell me. They're sweaty?
Yeah.
A little bit clammy, it's true. I think 'cause she has low blood pressure. She has an autonomic nervous system type.
It's your first time acupuncture with the nerve.
Yeah.
Do you not always pair with 27 when you do
I
that?
can't do 27 when she has asthma.
You can't do 27.
No, plus I don't have to pair. She probably is adrenal, but I can't do these.
Right.
When she has a lung, she had pressure pain here.
Oh, she did, yeah.
I'm not going to do it. And for me, adrenal is not the most important component for her. If your person, you know, or you think the orange is from adrenal fatigue, you do kidney plus kidney 27. Kidney meaning something below the
Sure.
We'll go through that.
Yeah.
Can you just confirm that though? If you've got pain on pressure,
I would normally, for adrenal, I do kidney below the knee plus kidney 27. Originally it was kidney 6 plus 27, but we have many other options. For example, if kidney 2 is painful, I do kidney 7 and 10 because it's metal water. Okay? So, but I can't, 27 I cannot do on her. It's not an option.
Because of the asthma.
Yeah, and she had pain. When I pressed kidney 27, she had pain there. I can't.
So you
I'm not
don't
gonna
need
kneel
all the
there.
points of pain?
Absolutely not. Unless there's a fabulous reason and I've released the pain. You know, remotely. But in her case, even if I release the pain, it's taking a risk to do 27 because that's where her symptom is. I don't walk into a symptom and stick metal in it. What do you know what you're going to do? You can stir up the shit. Not worth it. You know, Asha is like the dumbest ideology I've ever seen in my life because sometimes it works like magic. And sometimes, for the few times that it backfires on you, it's not worth all the times that it does a miracle. It just isn't worth it. You have one case that screws you up, you'll never do it again. You know, it's kind of like, it's too dangerous. So I stay away and there's always a switch somewhere else. There's 5 ways at least to do something. There's always another method.
Would you, what if it was particularly sore on, kidney 2, would you release other points so that kidney 2 then wouldn't be sore? Or
Kidney 7 and 10.
Yeah, okay, sure.
That happens, but yeah, I mean, that's one of the things I check. But yeah, if I want to use a point and the point is sore, and I have to, but we're not talking about a point that's clearly the symptom.
Yeah.
But say I want to use stomach 36 and stomach 36 is sore, I will do what I can to release it. And then I'm like, okay, I must use stomach 36. I'm dying to use it. Fine. You can do that.
So you'd never say needle the REN 12 directly in this case, even though you feel that's the problems that would be got.
I will never needle REN 12 on her. Absolutely never. There's no need to. There are indications. REN 12 is a reflex for me. It's not a treatment point, unless REN 12 becomes a treatment point if she has neurological disorders, or it's a point that has to do with the marrow. Okay, or she has spinal problems. REN 12 is great for back pain, all throughout neck pain especially. But anything to do with vertebrae, REN 12 is a good point. Okay, so then I want to needle REN 12, REN 10, and REN 13. They all have the same character in them. But for her, it was a reflex. It's the most important point for me as a reflex to fix, not to needle. I have no interest in needle REN 12, especially that she has slow pulse. Yeah? Yeah.
Earlier on you mentioned you said you were going to use kidney 9 and Li15. Did you change?
No, I could still, but, well, I changed my mind because then I thought you take no toxicity, but the truth is, large intestine 15 and kidney 9 originally were skin. So let's see what we can check large intestine 15 against. Relax, don't tell. Don't tell. Ah, you got it. Is that okay?
Yeah.
Is it pressing? Okay. So usually you can check it against the thyroid. Anything here? Oh,
Yeah.
Oh, yeah. How's now?
A lot better. A lot better.
A lot better, okay. So large intestine 15, nowadays we say toxicity point. Originally, large intestine 15 was skin point. Why skin? Because of toxicity. Toxicity is coming out in the skin.
But you were testing against thyroid.
Because I have nothing else to test against. Thyroid is anything to do with toxicity because it's a metabolic gland. It's going to show on the thyroid. Okay, so this is the kind of thing you do for atomic bomb victim type people. I lived in Chernobyl.
Scotland.
Did she?
Scotland.
What do they have there?
Yeah, Chernobyl fallout.
Maybe kind of person. They live with mercury. I don't know. I mean, there's all sorts of painters. There's all sorts of options of toxicity issues. Oh, I thought she was going to say, yeah, by the way, I paint houses.
Then eat them.
Do nails from home, and that,
Yes,
and the
yeah.
chemicals they use in that are unbearable.
Right, exactly. So, you have to think take it to expand the definition to whatever you're seeing. And anything here?
I did do quite a lot. Yeah.
Here, sorry. In her case, her toxicity is it's self-intoxicated. Well, what? No, not that kind. Because of the food, that's why she gets eczema. The toxicity comes from within, it's not external. How's now?
Yeah, gone.
Gone, okay.
And would toxicity also just be from medication, or is that?
Yes, can be medications, in which case, yeah. People take lots of medication, that would be a treatment we do for them. Absolutely, yeah. So, let's just do marks on the immune points. How are you feeling now?
Nice.
Nice. Yeah, go ahead.
When you're pressing the thyroid there, you were on the
You can
external side of
you
the...
can be anywhere from stomach 9 to large intestine 18.
So you do it on the inside or the outside?
Oh, yeah. Yeah, it can be either.
This, yeah,
Doesn't
either
have to
side.
be a particular side.
So it'll be sore both sides? Yeah, it tends to be sore either side.
Yeah, and it also doesn't have to be just stomach 9, can be below also.
Okay, just the general area then will be sore?
Yeah.
Okay.
So I just want to add the bafangs because of maybe depression, maybe not. By the way, let's look at her stomach. Yes, and she does have this. The only thing we haven't done up to now, because she had mononucleosis, the only thing I've done for that is the immune point.
Yeah, I'm fine.
And what I want to do something more for lymph, which will mean spleen. Spleen is the largest lymph node in the body. So we will check that in a second. But she did say spleen to pain, sorry?
No, I was just going to ask her if the tiredness came, was that just after the glandular fever, nothing before?
No.
Yeah.
You were not tired before.
No.
Okay. So we need to treat it, to look at it a little bit more seriously. Okay. So. Anything here?
No. Yeah.
Are you okay?
Yeah.
I'm going to do it probably a few more times. I'm sorry. I just have to check, but it might be that it will be gone, so it might be okay. Hi, now.
A lot better, yeah.
Okay. So spleen 9, often spleen 5 and 9 are for lymph.
For lymph.
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 She has glandular fever. It's a lymph, you know, it's a lymph thing, right? It attacks the, you know, the glands are lymph, right? It's just kind of a different word.
So that reflex where you were testing is what, just called the lymph reflex, or?
Well, I'm testing, no, actually it isn't, it would be around here, but I don't have any. Well, she could have on the mastoid, by the way. No?
A little bit.
A little
yeah.
bit, okay.
Yeah, yeah.
Okay, hold on. Okay? Hi, how's now?
Better.
How much better?
80% better.
Were you stomach 18? Was that where you got the pressure pain earlier
No,
on
no.
when you were down there?
Originally I was under the, like testing liver under the ribs, I was
you just
testing
went
the
under the
spleen.
ribs.
I went under the ribs to push on the spleen because the spleen is the biggest lymph organ we have. Okay? But, so then I did spleen, are you okay? I did spleen 9, and then because Fern asked me what other reflexes can I have for lymph, and I said, well, for example, around the mastoid. So I checked the mastoid.
Yep.
How's now?
I still feel it.
Okay, how much is left?
Can you do it again? Sorry. No, it's nothing.
Nothing?
Nothing, no.
Okay. Then on the other side, I'll have... well, I can do spleen 4 and spleen 9, that's okay, because spleen 4 is not a 5-element point. So, and
Hold on, I just want
Yeah.
to get
it's better if I separate them, but, you know. How's now?
Nothing.
Nothing, okay. Now, look at this. Sorry, this will sound uncomplimentary. She has what I call chubby spleen 9.
I need to come and see that chubby spleen.
I think you're going to have one too.
I most probably can.
When you push some, especially men, it's like flat. You can't get a needle in, you go, well, maybe spleen 9 is indicated, but I can't put a needle in there because you see how my needle's going above the, you know, it's not going towards gallbladder 34, it's going up. Here, I've got anywhere I want to go, no problem. I can take a big needle and, you know, whatever I want to do, I can do here. That's chubby because there's that. You know, some people, can you lift your thingy? I'm pretty sure he's not going. No, I actually have more than I would have guessed.
Shelby.
No. He is.
Been working on that.
That was the first time you've been called Chip.
Yeah.
No, he has some too. It must be a Qigong damn thing.
Can't get my
Or the
child with
Iyengar.
that.
I'm probably exactly the same.
No, you will be.
No.
Let go. Yeah, see, it's much skinnier. And how old are you?
65.
At 65, gravity is taken over. It's not going to be tight against the bone because you've had enough time for things to drop and separate. But I believe that I believe if I saw you 7 years ago, I wouldn't be able to, I would hit, the skin and the bone would be adhering together. That person needling, it's painful, it's not worth it. So,
So you just wouldn't use spleen 9?
relax the leg. Otherwise you do somewhat. Relax. Yeah, but not as much. But you have some sort of edema. I mean, it's puffy in some way.
Could be.
Could be.
You still use it though? You'd still needle it, did you?
On you?
No, I mean on anybody. If it
Well,
was
sometimes they have an
indicated-
indication for spleen 9, but I can't needle it because it's so skin and bone.
Oh, yeah.
I won't needle it.
No.
So on her, yes, I can because it's chubby enough. I mean, some people it's like, you're nothing. You're teeny chubby. Some people it's like huge.
So what's the indication
You know.
for it then when it is like that?
It's not so much the spleen 9 is like that, although it's more like if there's spleen 9 type. So what's a spleen 9 type? Appendix operation type person is spleen 9 type. Gallbladder 21 pain type person is spleen 9. Allergies, nasal allergies is spleen 9. Okay, so there's a spleen type that's more spleen 9 type as opposed to spleen 3. Spleen 3 is if they have pain on stomach 12, what you might call stomach 11. Okay, the scalenes. That's more spleen 3. Sugar addicted type is spleen 3. Okay, so we have different kinds of spleen types. You know, we'll use different points. Somebody may say, I had my appendix removed, I have pain on gallbladder 21, or I have lymph node issues. Okay, but their spleen 9 is like,
Yeah.
you know, and I can't get a needle in. I'm not going to, you know, it's just not worth needling. So I'm going to look for something else in the spleen. Does that make sense? So now sometimes if I don't find, I don't have a choice, so I go to where, and only spleen 9 did a good job. You know, I'll go, okay, fine, I'll needle it anyway because I don't have a choice. I mean, better do something than nothing. You know, but my preference is for skinny spleen 9, not to do a needle there, just because there's no space. Okay, but generally, the people who require spleen 9, 80% of them will be chubby, and very few of them, and usually only men, will be skinny. Okay, so, you know, but I can't say chubby spleen 9, I'll go do a liposuction on spleen 9, that won't solve the problem. It's not like that. So. Any questions?
I suppose it would be good if you could just very quickly sort of summarise the protocol and the diagnosis and the treatment again.
For her?
Yeah.
Okay, so she had I believe that originally the problem is REN 12 oriented, a weakness in the stomach. That's my understanding. We lost a lighter.
Yeah.
Okay, I do not have to ask for something. So my understanding is originally weak stomach. I mean, in terms of finding, she has stomach REN 9. She has something in the nervous system that's operating. So she had REN 9, she had Oketsu, adrenal, lung, REN 12, REN 15, and REN 17. So she shows all emotional reflexes. Okay. She shows REN 12. Immune related or lung related. Okay. So I'm saying the very first injury appears to be at birth, and and her symptoms is butterflies in the stomach. I'm saying if I fix the rugae, if I strengthen the rugae of the stomach's ability to expand and contract, I believe everything else will get better. Remember, REN 12 is also the master, just like gallbladder 34. The name of REN 12 is master of the fu. Didn't you guys learn all this kind of crap? Wow. Okay. So, just like gallbladder 34 is the master of the tendons, REN 12 is master of the fu.
Three there. I
And
thought
what's
you were
the-
asking for the name.
Yeah.
I was joking, I said.
Yeah, sorry.
Sorry. And what's the, who's the master of the zang?
17.
17 who?
Uh,
He is the master of the chi,
oh yes, that's true, he is.
liver 13.
Thank you.
What did you do?
Kept it up.
Kept it up?
Technique, Avi.
Yeah.
Hmm?
Technique.
Yeah, I know, that's what I'm asking. What did you do?
I don't know.
wanna learn.
The master of the lighter.
Master of the lighter. Lung 11, master of the lighter.
Sharing our secrets.
Thank you, that's very kind. So, so I believe her original problem starts with a weakness in the stomach, therefore creating toxicity in her body, and therefore creating the asthma. So I think the asthma originally starts from the REN 12 situation. So if I can fix REN 12, I believe everything will get a little better. She'll feel a little more solid, and perhaps the anxiety, there's a certain kind of anxiety if it's butterflies in the stomach, and that we do this.
You know when you mentioned...
So that's the main diagnosis here. Now, I went and tried for other things, and you can see I'm adding. I personally, Kiiko, if you see her in class, she'll sometimes stop at the main idea, because she wants to demonstrate something, and that's good enough, and it makes it very clear, but sometimes it actually doesn't, for some reason, I don't know, because people always complain, I don't understand. I'm like, what do you mean you don't understand? It's very clear to me, but it isn't clear to them. I want to show you the whole method of working, rather than just treat this, just do this.
Can you just explain one more time the relationship of the stomach and toxicity?
In her case, not in general, in her case, the toxicity started at a very young age. Her stomach wasn't able to take the milk, and what ici on say, created phlegm. So it showed the skin got weak as a result. As opposed to, and eventually it moved on to becoming asthma. Okay, so I think it's a toxicity in the sense that she could not digest the food well because the stomach lining is weak. That's my theory on it.
So toxicity over what genetic aspect was it then again? Or sort of what?
Her mama had eczema also. That's why I went for spleen 4.
Okay.
So it was basically a way, spleen 4 is not a REN 12 fixer. So I mean, now that I'm looking at it, I'm doing spleen 9, I'm going, maybe I shouldn't have spleen 4. But I do already, so maybe, I don't know, maybe it's a great point for her, I don't know. Sometimes you do things and you're not sure. I do a lot of insurance. I don't mean insurance billing. I do things and then I ensure that it stays by doing a little extra. It's another needle, it's not a big deal. You don't have to be a purist and, I can fix REN 12 with just this. So I can fix REN 12 with 5 things and I might use 3 of them. Because it's better, as long as they make sense, it's better to do a little bit more, not too much more. How come you're moving your toes? Is something uncomfortable?
Yeah.
Why am I burning you?
Yeah.
Because it's Halloween time.
Didn't expect that, did you?
No.
You know when you use
You just expected needles?
Yeah.
It's too late now, you signed the disclaimer.
See, I don't tell them, I just do it. Then I say, what's the matter with you? Why are you moving your feet? They go, because you're fucking burning me. Sorry, Moxa books?
Moxa points.
Uh-huh.
Did you say they were element on element?
Element on element would usually be a Moxa point, except certainly kidney 10 is not. Immune point is a Moxa point.
Okay.
Liver 5 is a Moxa point. Large intestine 15 would normally be a Moxa point, but because she's new, we are being generous and won't do more. And just what we're
And any
doing.
particular reason you think that?
Sorry?
Any particular reason that you
Why
would?
something's a
explain?
Moxa?
Yeah.
Very hard to explain. Some of it is tradition. Some points came from a moxibustionist as opposed to an acupuncturist. So we, in reverence to that, we do Moxa. I believe that it's Yang Ming and Yang Chao meeting. Lots of yang, you want to move it. I mean, this is about raising the yang. Large intestine 15, I know it sounds kind of weird because you think of clearing toxins as cooling. But if you raise the clear yang, the toxicity will go away. That's my understanding. I can't guarantee that that's, that's true. All I know is this is, some points are by empirically are Moxa point. Spleen 7, we tend to do Moxa when we do it both for stop bleeding and for accumulation of water in the legs. So some points we just over time, you just get, there's a list of points. And I think I pretty much gave most of them to you already, so.
Do you think it's like where, because I don't know, this immunity point I would naturally massage, but it feels like where things attach to other things?
Yes, it's where the muscle and the bone attach. It's, okay, remember immunity is also here. It's where the muscle and the iliac crest attach. There is something about some bones and muscles where they come together that has to do with immunity.
Okay.
What it is, I don't know. But, and you'll see when we turn her over, I'm going to do under the scapular spine. That's the major lymph node, lymph clearer for me.
And then if it's like toxicity, why would you not expect the eczema to be more toxic?
Well, that's what I'm saying. I don't think it's really toxic. You know, I think originally it probably was toxicity, and then it's turned into just because the stomach isn't strong enough, so she's not digesting the food. It creates the dryness.
Okay.
But the skin originally, because of the wounds that created it so early, the skin's already developed a pattern of being too thin, too prone for splitting and stuff like that. And then when she gets with external object, like she's washing her hands, like you don't see it here because she's not constantly washing her shins. So you just see the blood vessels coming up.
Not showering every day.
Sorry? You wash your hands more than you shower. As far as I know. I don't know. I don't know what you guys do in England, but most people will shower. If they shower twice a day, it's a little obsessive, right? You know, when people, it's kind of fun. But that's the most people do. Unless they're like, okay, and I went and shoveled the pig manure and blah, 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 and I'm going to a party. Okay, yeah, of course they're going to take an extra shower. But, you know, 2 showers a day is like pretty much the most regular human beings will do, which is probably more than you want to begin with. You know, given that you're just removing oils from the skin. And it's not the end of the world.
The English only shower once a month, of course.
Yeah, I've heard.
Whether we need it or not.
Yeah, whether we need it or not. It's the temperature, it's colder here.
In a way, it's, I don't know about the once a month, but, you know, there's something healthier about, because Americans are obsessed about showers. You know, Americans take a shower once a day whether they need it or not, and that's a minimum. So in a sense, and they're washing their hair, it's kind of like they're taking all the oil away from the skin. I don't think it's so healthy either. But, that's what people seem to do. So it's like, but suddenly you can't, it doesn't matter. That's what they do. All right. Any other questions?
You talked about the 3 stomachs a minute ago, didn't you?
3 stomachs, Ren 10, 12, and 13.
Yeah.
What do you call that?
She's a goat. She's a camel. She has 3. Okay. Now, what's the story about that is Ren 12 is called Zhongwan. Okay. Now, the character 1 nowadays, it's unfortunately not meaningful. But what Kiiko is claiming, because I'm looking at the character and I'm like, I don't know what you're talking about. But she's saying that if you look at Han Dynasty dictionaries, that character means something fat surrounded by something. Okay? What's fat that's surrounded by something? It's the marrow. The marrow, that yellow substance, is fat. Okay, it's a fatty, it's lipoids. Okay, marrow is a lipoid substance. It's a fat that's surrounded. The brain, the same thing, it's surrounded. Now, we'll get to that. So something that's, there's spinal fluid, for example, surrounded by bone. Okay? So she's saying surrounded by bone, something fatty surrounded by bone. I don't have Han Dynasty dictionaries, I can't check it, but that's what she's saying. So 12 is called Zhongwan, central one. The Ren 10 is called lower one, and Ren 13 is called upper one. Okay, so these 3 together, or each, the 12 is the most important, but if it's in the lower part. So for things like Parkinson's, MS, stuff like that, we're very interested at that point in needling Ren 12, 10, or 10, or in Ren 12 and possibly 10 and 13. Make sense? Neck problems, I'll go for 12 plus 13. Lower back, I may go for 12 and 10. Okay? 12 is always there, plus maybe the upper, plus the lower, maybe all three.
Okay.
Okay? But neurological syndromes, also, it's the fat that's contained inside the myelin sheath. You know, I know it's a little hard to think of nerve conduction as fat, but what are neurotransmitters? They're lipid acid. They're fats. Okay, so we're extending it. Anything to do with neurology has to do with REN12. And I was thinking, so another thing. So what's this big importance of checking abdomen? Okay, so if you look at the picture of the intestines and you get all this like braided stuff, what does it look like?
Brain.
Yeah, exactly. It looks like your brain. The only other place in the body that you have all this, you know, braided kind of stuff is here. Okay? Now, where is the largest accumulation of nerve plexuses in the body?
Nerve plexus. What's a plexus being?
Junction of
Junction.
nerves. You have the brain, obviously, you know, from the neck. You have, you know, and then the enteric nerve plexus. Okay, so the intestine and the brain are highly correlated. You know, now they're coming up with all this thing about how your microbiota, the microbes in your intestines are affecting your moods, and they're saying if you eat yogurt or do probiotics and stuff, it affects your moods. And it's 100% true. I mean, seriously, and not just my personal experience, but patients. You know, you try like eating too much sugar or we eat really bad. I mean, I'm not recommending, but if you do, by chance, it happens that you overindulged and you're feeling like, ugh. Like you don't want to go anywhere. You have no motivation. If you eat yogurt, it changes within 3 or 5 minutes. It changes your mood. It gives you a little bit more of a lift because you're doing probiotics. So one of the big therapies they're doing now is look at her feet. Look at the usage. It's okay. I want to show them.
It's starting to spread.
It's tense. Yeah, but she's also tensing at the same time. So there's a way which her feet are involved in this whole thing. What I'm going to ask you to do, where do you live?
Caversham.
It's near here.
Ready?
Like 15 minutes
Okay,
away.
they don't have any beaches here, right?
Sound down.
Okay, never mind.
Here's something.
No, broken glass.
Yeah. Cigarette butts.
Okay. There's no sand anywhere around here.
Well, we're saying sand pit in the park, but
There is sand in the park? With glass?
yeah.
Okay, forget that. I'm going to show you. I want you to walk a certain. I'll show you a way to walk. I want you to activate the feet. But walking in sand just does it naturally, so they don't have to think about it. So that's why.
Footwear, you know that there's that
Yeah, I
barefoot
don't.
stuff.
Oh,
Put
yeah.
sand in your shoes.
No, but she's okay. Those shoes. I mean, the problem with those shoes.
They're flat.
I'm okay with them being flat. I don't mind that they're not supported or something, and I certainly do not want you to walk with heels. The problem, even though they're not holding the foot, there's a way in which that lack of holding, but you still have to hold them, even though they're tight on you. They're like a little flimsy, and yet they have a sole that you have to pick up with you. You need, in my opinion, a more solid shoe, but that's soft, that has a sole that's soft. So
Okay.
Does that make sense?
Yeah.
So you want a shoe, you do not want to wear flip-flops.
Okay.
You know, you don't want anything that you have to carry yourself.
Right.
It needs to be, you should not be doing any work to carry the shoe.
Okay.
So it has to have a back, you know, so for example, like I wear clogs, not good. Okay, because you actually have to hold the clogs yourself. Okay, you don't want to do that.
So what do you think's like caused her feet to be like that again?
Sorry?
What's kind of the link with the feet, or what do you think's going on
The
with?
feet are very related to depression and anxiety. You know, they're highly related. First, because of oxygenation, for one thing, but also because the area of the brain that they occupy. You know, and also because of posture. So it's a little bit the same idea of this shui, that this area, not only does it occupy a lot of space in the brain, it also affects the gait, the posture of the whole body. Okay, so I want her to activate her feet more and have less tension in them, rather than, she's used to.
Could she wear Japanese socks around the house, the ones with the toes?
Sure. Do they have do they have ones that separate all the toes?
Yeah.
There are toe spreaders you can
Toe
buy.
spreaders.
They're very good. They just circle around one, and they come under the toes and they'll spread the toes. They're very good.
Isn't that
You
for
get them
painting
very
nails?
cheap.
Yeah, that's what I was going to say.
Nick? That's what you do when you're painting your nails.
Very similar to a pedicure, yeah. But the research was purely for.
You could also just have a pedicure. That sounds like fun. Sorry. Let's flip you over. I think you need to freeze not too tight.
Can you make me a tea?
Lift the belly for a second. A little more for a second. Okay, perfect. Are you comfortable?
Maybe pillow under the chest.
I think, yeah, I'm looking at how shifted she is towards this side. Move slightly to here. Thank you. Is that okay for you, or
Yeah.
that feels uncomfortable?
That is better.
It is better?
Mhm.
Okay, so
You want something for your head?
she's in the, she has
I know,
the
but she's
face
sort of-
weight.
Yeah, no, that's okay.
Yeah?
Fine,
You
yeah,
like that?
thank you.
You can move your arms if you want. No, it's totally fine. You can do whatever you want. Okay, you're on your period. I'm sorry, I didn't forgot. Okay, so stomach should reflect on T5. Any pain?
Yeah,
This one.
yeah.
Okay. 1, 2, 3.
Yeah.
Anything? Yes. Okay. So this one and this one. Okay. So can you do two? Do one right now. How's this one here?
Better.
How much better?
A lot better.
A lot better. Okay. So I'm going for the other place, the traditional place of stomach in TCM is T11, T12, right?
Mhm.
So one place will affect those extreme those shifted places in the spine will affect each other. If you have pain on T5, you can use T12. If you have T12 pain, you can use T5. Okay, the extreme of the places where the thing shifts, and it was. Okay, this is okay now.
Mm-hmm.
Okay, how about here?
It's better.
But there's still some.
A little bit.
Okay. Hi.
A lot better.
Did they ever say hi back?
Sorry?
It's a bad joke.
I didn't hear it, so I can't.
It's got to that stage when Nick thinks he can start to be cheeky.
Day one.
By the
Done
way,
quite well.
oh wow, you would expect the bone to be here, but it's actually here. Okay, any pain here?
No.
Because of the mono, I'm looking at the option, the glandular fever.
The what?
The glandular fever might reflect here still. No. And her IBS also, because large intestine shoe is this level.
Mm.
Nothing.
Mm-mm.
Okay. Next. There's going to be, so under the scapular spine, so small intestine 12 is here. Underneath is the point that I use for all sorts of lymph issues. Okay, especially in the lungs, but everywhere in the body also. 1, 2, 3, 4.
Yeah, 4.
4, okay. Now, I want to check it. So, anything here?
No.
Hmm?
No. Yeah.
Yes?
Yeah.
Okay. I told you the mastoid will reflect glands also. When I press here on the shoulder, I'm sorry, how is the mastoid, the neck? The
gone.
neck? Hmm?
It's gone.
Gone. Okay. Wonderful. And I needle it up towards the bone because, yes, immunity has something to do with how certain muscles and certain bones meet. So I'll add, because it's an area, so I'm going to add a little more. And okay, if you want to feel this, you'll feel it's almost like slightly puffy. Go ahead.
That's not a
Just be careful to
classical
choose.
point.
It's not a classical point because it's below stomach 12. I mean, slight as 12.
Again, that's one you find very tender in a lot of people.
You will find it tender, but it's not about finding it tender. It's about if they had a lymph problem, touch it. There's a certain way it feels that I care about. And what I'm doing is I'm trying to confirm that it actually fixes something. Tell me when on the right side. Yeah, here.
Yeah.
It's under the spine. Okay, how's now?
It's gone.
Gone.
What was it that you said? It was puffy feeling.
Yeah, there's
No?
like it's almost like there's a little ball underneath it.
Oh,
Did you-
okay.
Yeah? Can you soften the finger? Don't straighten the finger so much. Okay. And move in with your body. But you straighten the finger. The problem is, the more tension you have in the fingers, the less you can feel, the less feedback it comes back to you. That's better. Do you feel?
I feel something I can't.
I can't,
Yeah.
again, it's
Yeah.
one of those things where you just have to,
Yeah.
I have to
Yeah.
trust that you probably, if you're feeling something different
Yeah.
there, chances are you're feeling what I'm
What I'm
feeling.
feeling, okay.
I can describe to you what I feel, you can describe back to me what you feel, and we can decide that we believe it's the same thing, or we can decide that, oh no, you're feeling something totally, we can't tell.
It's fine.
It's
yeah,
a
yeah.
problem.
Yeah, but I like that. Bent finger piece. Yeah.
Now, to be honest with you, IBS should be left side spleen metal water, where we kind of did the obligation on that, and right side, it should be either spleen or liver metal water on either side. And then for constipation, our main thing would be stomach metal water on the right side, on the left side, and gallbladder metal water on the right side. Left side will be stomach and right side will be gallbladder. So IBS can be a mixture. The other thing about IBS does show on stomach 9, which remember she showed, so that's why large intestine 15 fixed that. I didn't go and needle stomach 9, but I could have.
And do you feel this is the best way to access the shoulder point with the arms like this?
No, it could be, arms can be anywhere, that's her choice. I actually prefer, I tell people, hold on, I'm just moving there for a moment. I tell people that this is the most comfortable position. I find that position, I actually use a real headdress.
That is more comfortable.
Okay, then move the other one, that's totally fine. I find, and I'm used to this position because I tell people if you do it like this or over the table, in 5 minutes you're going to feel strain in the arm. All right. Officially there should be Maxa, but she wasn't thrilled, so we let go. All right. Questions?
Does this area feel
Yeah.
like, when you're pressing it, it looked like it was felt a bit deficient, a bit hollow, that sort of junction?
Can you explain to me what that means? I mean,
Like there's no resistance when you're pressing it here. Just constantly hangs all swollen.
you mean, actually, is there something here?
A little bit.
A little bit, yeah.
It just looked from outside.
It wouldn't be my language. I think I know what you mean. You'd expect it to be like more tissue, I
Yeah.
think. For some reason she's built, it's almost like, even without my pressing, you can say that this area is thinner than you would expect in most people. You'd expect it to be a little bit more, you want the butt to come up here. You want like a chubby spleen 9 feel here. And it isn't there. Is that what you mean?
I mean, I
Or-
just look and saw the way you were feeling, and
Yeah.
looking at that area just generally looks
And there was not
deficient.
enough tonicity? Yeah, it's possible. Don't forget she has something in the intestines, but I'm thinking that the intestine thing is coming from the stomach rather than the intestines, but I could be wrong. The thing is, if I needle around here, that's large intestine area. And because it's L4. And I'm a little bit, I don't want to mess with her intestines and go too closely to it. So that's my discomfort with dealing with this. Okay, any questions out there?
Was the mastoid not painful on this side, or?
It was, I checked both when while they were palpating, I did the right side.
Oh yeah, but you didn't needle this side, did you? It was under there
Excuse
somewhere.
me.
Ah, fine. That's right. Okay. It was under there. I missed it. I blinked.
Yeah, well, no, because there was concentration there and I just kept,
Yeah.
okay. Other questions?
Could you just repeat with the IBS which ones you're using for constipation, which was diarrhea?
Okay. Well, no, it has nothing to do with the IBS. For IBS, what I use is Mushu, or I have two options for IBS. Either Mushu or I take below Mushu, take the trochanter, go in front of the trochanter. Okay? And stomach 9 is good for IBS. Now, for constipation, I use stomach metal water on the left and gallbladder metal water 43, 44 on the right. And for IBS, I generally use spleen and or liver metal water if the fire point shows. My fire points were not showing. None of them were showing. Okay. Let's talk about the heart channel.
I was going to say, we just generally tonify the stomach. I'm just sort of thinking, you're talking about heart, fire.
I was talking about heart fire?
No, you were talking about the heart. Let's look at the heart channel.
No. Oh no, I said let's look at the heart channel. Nothing to do with her.
Okay.
She has a heart channel here somewhere.
Yes.
No, theoretically. No, I'm sorry. It wasn't related to her.
Okay.
I was like, let's do a little lecture. Yeah.
You did T5 and it was sore, so you relieved it with at 12 there.
Yeah, and I can now needle T5.
Oh yeah, you would
yes.
now maybe consider doing T5.
Fine. No.
Yeah.
You're right. We should. Let's be thorough.
Yeah. And then, why were you doing T5?
Relates to the stomach.
Fine, thank you.
Nerves to the stomach
Yeah.
start at T5.
Nerves to the stomach.
So, yes, I think quite Western. So, this is okay now?
Yeah.
Okay. Because her symptom isn't here. This is the nerve to the system, so I can stimulate this. If her system, now T5 also because, we say, she has neurological kind of situation. She's not saying I'm not sleeping. By the way, how is your sleep?
It's not so good actually at the moment.
Sorry?
It's not so good at the
Not
moment.
so good. Okay. Sorry. A little bit moxa, but it's a kinder, gentler kind of moxa. So this is if you want to practice moxa, you want to do that on patients who have, insomnia. Go to the center of the heel. Okay. And it's also a great point for people who have lots of pain. It releases opiates or whatever, pain.
Everywhere.
Yeah. Anywhere. Okay. I don't know about everywhere, but anywhere.
Anywhere, okay.
So.
Does it often blister, the direct moxa?
No, it shouldn't. Why? Did somebody get a blister?
No, I have once having it done, had blister.
Yeah, but you're having it done by someone who doesn't put cream on.
Yeah.
Sorry,
Well, I
don't.
think so. No, I didn't
Wait,
think-
you told me he doesn't
I
put
don't
cream
think-
on.
No, does Andy put cream on before doing direct moxa?
Andy, yeah.
Because you said he did. Okay.
Yeah.
I don't know.
He's
I
a bit
don't
gun-ho.
think-
Sorry?
He's a bit gung-ho.
Oh, with his moxa?
Yeah,
Oh,
sometimes,
okay.
yeah.
I don't know because
Yeah,
I can't.
You
I
have to
don't know what
scream
he
really
does.
before he stops.
Oh God.
Almost, yeah. Thinks you're a wimp if you can't take it.
The cream is
Okay.
called Shionko, but it's lithospermic creams. I don't know. They sell them in different places. But the other thing is, I did bring three. There's 3 of them. Anybody wants them? There's 3 you could take. Oops, one place,
Oh,
one
it does,
place.
yeah.
Looks like you've taken blood.
Dracula.
Just look like that.
So I could
One more available.
do it writing it down on the name.
So if you go on my website, we'll tell you how to make it. There's
Oh, you make
instructions
it.
on how to make.
Okay. Oh, cool.
Oh, where's the moxa itself? What am I doing?
You probably use that actually. Take that one.
And then the moxa that you're using there.
The moxa, okay, the moxa is called pure gold moxa. It's cost about, depending on where you get it from, and I don't know what your supply options are here, it should cost you something like $100 or more for 100 grams.
So you're using how many grams in that bag then?
That is, oh, this bag is like, I don't know, 3, 4, 5. It's a box. It's a fur. Now, if you get it, some places in Japan you can buy them and they'll be less, and they have many grades and whatever. But the top grade will cost somewhere around $100 for 100 grams.
Would you be worried about the what's the word? No, the nuclear plant.
Oh, Fukushima.
Fukushima and moxa?
Yeah.
Wow, never
well,
thought
I
of
think,
that.
Yeah, because John was saying that you can't really get Japanese moxa now over here because of that problem.
I didn't know. I just, well, OMS in the States sells it. First of all, okay, I have enough moxa probably to last me a lifetime.
Right.
But I did, no, because you know, you buy, so, but, so my moxa is pre-Fukushima, but no, actually I do have a box that I bought a year ago from someone who was a Pacific Symposium, Japanese guy, and it was like $80 including the shipping. It was like, and it was good moxa, so I don't know.
What difference do you think it makes, the quality of moxa?
Huge, because it has to be fluffy. If the moxa is too condensed, it hurts. It's too hot. The moxa, okay, look, I go like this, it's very light, I transfer it to this hand, I pinch, and I put it down, and it's fluffy, okay? So the Chinese stuff, the more brown it is, the hotter it burns. You want moxa that's fluffy. Now this is a big piece, for example, but on the heel, on the heel it's okay. You don't want it too hot.
And he sells several types of the super pure moxa on his website.
Fukushima special.
But you can easy to find the packages at night because
easier to find the money to pay for it. It's expensive.
Yeah,
it's expensive.
It says Japanese moxa and ended up getting the Korean moxa.
Yes, the Korean moxa is different. You can do this kind of moxa with Korean. The Korean is a hell of a lot cheaper.
Yeah.
Okay, and that's how you know.
Yeah.
And the Korean is slightly brown-green. And it's yellow, but it has tinges of brown and green in it, or tendency. It should be. This is the color you want it. You don't want it brown. And the Chinese is really brown.
Is it like different seasons you would use different grades of moxa?
No, for me, no.
Okay.
This is for this style. There's a difference. Because you're talking about like doing big globs or something, or But if you're doing direct, no, the season doesn't matter. You want it like I'm not trying to heat the person up. I'm trying to heat them up. Either you do what we call kyutoshin, which is moxa on the needle, glove. That's different. That's heating the needle, and that's for cold. That you do when you press inside and it's cold. Okay, but on the skin you do because either the skin is cold, you want to dissolve the connective tissue, so it's nothing to do with it's winter and it's cold. It's just that some people, for example, their feet are cold, so you have to do moxa to move the stimulation of the needle. Otherwise, the needle's not moving because it's too cold. It's too stagnant there. So you're just introducing more energy in there. But no, I don't know anything about the seasons and different kinds of moxa. Okay.
Can I ask a question?
Yes, of course. You can hide too. But you can ask a question.
I'll get cut off this one. Would you not be able to use the heat fan for a similar effect?
To heat a needle,
Heating the skin.
No. First of all, look how tiny this is. you know, it's like pinpointed.
Yeah.
That's why tiger worm, it's not the same. They're not going to feel the same mosquito bite feeling. But no, a heat lamp is good for if you were going to do Kyutoshin, which big marks on the needle, and you don't like the smell, you can just heat it with a heat lamp, yes.
Yeah.
That you can do.
Because it lasts for days, doesn't it? That's what I can't stand. It makes the house.
Oh, no, I
Smell
don't, well, but this doesn't.
No, this doesn't.
This doesn't smell like
Good.
anything, just the incense
Yeah.
stick, it's no big deal.
Yes, good.
So it's a very different kind of moxa, but it's not moxa in the sense of why the Chinese use it for heating. This is stimulating the point in a different way than a needle does, meaning it dissolves the connective tissue.
When we talked about the different, is that then pure mugwort? Or is
It's not mugwort at all.
mugwort the plant grows?
It's the wool that grows. You know how some leaves you walk around and you see like white woolly stuff on the leaf? That's what this is. It's not the leaf. It's that fluffy, cottony-ish stuff. Whereas what the Chinese sell you is the whole damn plant, basically, grounded together, you know, with no separation. This is just, so, you know, ideally, it's just the wool.
And you said it's stimulating the point and dissolving the
Connective, the gumminess in the connective tissue. And that sends out some sort of biochemical message. I don't understand all the, you know, the biology that's behind it, you know, etc. But it seems to have an effect.
So what's the reason behind the way you are particularly at
This
the
is our
moment for them?
insomnia, but I don't know. Okay. Unlike Kiiko, I'm very happy to make it up.
Okay.
So if you ask Kiiko, it will, because that's what my teacher told me. It's like, okay, well, I
What's
honestly,
your reason?
my reason is because that's what my teacher told me, and I
Okay.
do it. And you know, but if you want to know, because my whole point is, it's all about stimulating the mind, so that we can invent our own systems and we can resonate with what we're doing as opposed to just do it. Okay, so I think it's very valid to ask why. I believe, okay, this whole thing about the heel, we're standing on the heel, changes the whole gait. Okay? So by taking the center of the heel and you stimulating something there, you're sending a message that is a relaxing. Apparently, we believe this point releases opiates in the body. You know, what are they called?
Endorphins.
Endorphins. Okay. That's what our understanding is. I think the reason why, because if you're going to have an uprightness in the body, that's an endorphin action. And that uprightness has to do with the heel. That's my understanding.
I heard that there's like an extra point there in the centre of the heel that opens the side branches.
The side branches?
Yeah.
Of the Chong Mai.
Yeah.
Okay. I never heard of. I mean, you know. So, and who says that? By the way, I'm just curious.
Oh, Qigong teacher of ours.
Okay. So, well, you know. So again, you know, this is the thing. I mean, because this to me sounds like. What's the authority there? And not that I care, but you know, I'm just saying it doesn't resonate from my from my background. But then I'm saying, okay, now can I relate to this? Okay, so I'm just showing you how I would relate to it. So if you're going to create uprightness, I don't know what the side branches of the Chong exactly is, but you're pointing at something here, which tells me that it has something to do, you're talking about the Chong, and on the side it means that you're probably talking about something that goes from stomach 30 up towards the chest. That will be my understanding of it. That means you're talking about the chest chi. There is a description of the chest chi starting at stomach 30 moving up. Okay? So if I'm creating the uprightness, which also, don't take it just as upright, don't get too stuck with upright. Remember that upright means airiness. It means I'm creating space for the Zong Qi, the ancestral Qi, or the chest Qi, if you want. So I can relate that in a sense to what you're showing me as the side channels of the Chong, but I don't know what they, I mean, I haven't, I've studied with this person, I don't know what they mean, I'm not sure. But it kind of makes sense to me. The center of the heel and fluffs things up, sort of thing. So, and don't forget, the Chong is to surge, to move forward. Pressing the heel moves you forward. You press the heel to move forward, right? So that would be my understanding of that, of that interpretation.
Sure.
Didn't you say earlier the wise sage without insomnia breathes through his heels?
The wise sage without insomnia, I did say that part, but the wise sage should be able to breathe into the heels. I was going to show you that it's possible.
Putting the moxa on the heel is helping.
Encouraging
very close to the breathing of the heels.
Very nice. That will be very
close to
good.
the kidney
That's perfectly.
Taken at a different angle.
That's perfectly fine. Yeah. No. That I'll buy
Just
into.
a mistranslation of the wise sage. They missed the little bit that said with insomnia.
No. I think that's perfectly cool. No, don't forget. No. Wait a second. It's not just. The point is it's an endorphin releasing, therefore calms the nervous system. Therefore, because she has an autonomic nervous system disorder.
That's great.
So it's a good point.
You're right, Sarah.
Yeah.
Sorry.
Yeah. I'm good.
You're done. Sit up and tell us how you feel. A little tired.
Yeah, I'm ready to sleep.
How's your abdomen feeling?
So much better.
Yeah?
So much better.
And stomach? Abdomen, I mean lower abdomen, like the crampy area.
Yeah, I don't have anything.
Okay. I don't know if you had it when you came, but, and this, the butterfly area?
It's a lot more reduced. A lot. I can hardly feel anything.
Thank you. Thank you for coming. So let's talk about the heart channel. Yes. The reason I teach the heart channel is,
Let's rearrange.
Rearrange spaces and.
Space and read on the one point.
Sorry?
At one point it wasn't considered to be a channel.
Yeah, that's what they say, and I don't buy into it, quite honestly. For a number of reasons, because the Chinese really love numbers, and 11 is not a number. What kind of number is 11?
How do you turn?
No, but it's like 12 is a number, there's a completion there, and also there's 6.